Hi, I chose to do this week's discussion on ethical decision making on the family members' presence during Code Blue. For this, I did create a hypothetical case study in which a 93-year-old female patient was found down at home by her home health nurse for an unknown time. She was receiving home health services due to multiple comorbidities, including advanced COPD and the need for wound care. The patient did not have a pulse. The nurse started CPR and contacted EMS. EMS, upon arrival, patient still needed CPR. They did 5 rounds, and patient achieved ROSC. Then EMS intubated the patient, put him on paralytic medications, and transported him to the ER in critical condition. Once the patient arrived to the ER and was being transported to the ER stretcher, the patient coded for a second time. Staff started CPR and family was contacted. A son was the only family member that lived close, and he responded that he was also the power of attorney and that he would be coming to the hospital. Patient achieved ROSC again. Son arrived to the hospital and was at the patient's bedside. 15 minutes later, patient coded for a third time while the son was at the bedside. So this is where our ethical dilemma comes in. In this scenario, it's whether to ask the son to leave the room or let the son stay in the room. So I'm going to address the first possible decision of having the son step out of the room. So the consequences to this would be the son not getting a chance to witness directly what the efforts are of the staff in the room, and that he may not fully understand the decision that he's capable of making as the patient's power of attorney. The benefits to the patient of the son stepping out of the room is that there would be no possible interruption of the staff performing the tasks they need to during this critical time. The potential harm or burden to the patient is that the son won't see the reality of the situation and could make different decisions regarding the health care for her. Now I'm going to discuss the other option of having the son stay in the room. The consequences of this are that the son may be distracting or interfere with the staff's responsibilities, and also the son could encounter and experience personal emotional trauma from viewing this event. The benefits to the patient of the son staying in the room is that the son is able to make informed decisions for her medical treatment. He sees what's being done to his mother. His mother's elderly. His mother has multiple comorbidities, and he gets to communicate with some staff member who would be available to answer questions. I mean, in a perfect scenario, hopefully there's enough staff that someone can be designated to keep him calm and answer questions and explain what's happening. Another benefit to the patient is that if he does decide, hey, that this is not what my mother would have wanted, and to stop the life-saving efforts, then this would stop further harm and suffering to the patient. The potential harm and burden to the patient is that the son may get in the way of treatments that are being done for her the life-saving efforts that are being completed. For this, I chose to apply the ethical theory of consequentialism. So the decision was made using this theory to allow the son to stay in the room And this decision was made by applying this ethical theory that since the patient is unable to make their own decisions regarding their medical treatment at this time, that the son should be as informed as possible. The team thought that the outcome of this decision would be in the best interest of the patient as well as the patient's son. The ethical principles that were applied are non-maleficence, so do no harm. The team's decision to have the son stay could lead to ceasing the resuscitation efforts, and this would ultimately lead to no further harm or suffering to the patient. And then the other ethical principle that I chose is paternalism. Since the patient isn't able to make her own decisions at this time and the son is the power of attorney, the decision to allow him to stay in the room is he's just going to have a better understanding of the situation and be able to make the best decisions for his mother. Okay, well, thank you so much for your time.